Hello and welcome to the channel Ask a Doc. In today's video, we discuss a rather alarming symptom. Why is my urine red? Red urine, although alarming at first glance, is a symptom that encompasses a wide range of potential causes, varying from benign to severe medical conditions. The presence of red urine can be indicative of various underlying factors. First thing to say is, though, is it really your urine that is red? Rather stating the obvious, sometimes red urine may not at all be red urine, if you see what I mean. It could be just a period. Now, unless you are a 10-year-old girl experiencing your first period, this should not be difficult to differentiate. Except that even in older women, unexpected menses or even uterine bleeding from another cause, for example a miscarriage when a pregnancy was not even known about, can be a rather unexpected or alarming cause of so-called red urine. So always try to differentiate, especially in women. So, other than gynecological causes, what other causes of a red appearance of urine are there? Well, an often overlooked cause is dietary. Certain foods like beetroot, even carrots, can cause a reddish or orangey hue to urine, as can certain artificial food colorings and spices. I shall go into dietary causes a little bit more further down. In medical parlance, when we talk about blood in the urine, we use the term hematuria. Now, if we consider hematuria, first of all, the most straightforward cause of red urine is the presence of actual blood. Blood in the urine can result from various conditions like urinary tract infections or UTIs, kidney stones, bladder infections specifically, which is of course part of urinary tract infections, which also includes kidney infections, otherwise known as pyelonephritis, or general inflammation of the urinary tract. In addition to this, several other conditions which may not be to do with inflammatory conditions or infections, like simply having a septum or a wall in the bladder, can also lead to blood in the urine, a so-called septate bladder. Here it is important to distinguish what we mean by blood. A urine dipstick test or dipsticks can be done in order to pick up intact red blood cells, which are known as erythrocytes. This is the most common cause of what we mean by blood in the urine, because erythrocytes are principally what is meant by blood in the urine, so having intact red blood cells in the urine. But, and this is very important, it is also possible for these urine dipstick tests to pick up hemoglobin, which is simply a protein found in the red blood cells that carries oxygen in our body and gives the blood its red color. So hemoglobin can be picked up even in the context of non-intact red blood cells. So this is very important because hemoglobin can then be detected in urine in the context of an illness that causes breakdown of red blood cells, So, for example, in transfusion reactions, in blood disorders like sickle cell anemia, all of these can give a false positive result in that case. In addition to hemoglobin, urine dipstick tests can also pick up another protein which is loosely related to hemoglobin called myoglobin. Myoglobin is a protein which is found in muscles and which ends up in urine as a consequence of muscle breakdown due to certain muscle conditions, particularly myositis or inflamed muscle, or another more life-threatening, more dangerous condition called rhabdomyolysis, which is caused by muscle injury of some sort. One particular distressing cause of rhabdomyolysis is when an older person falls, for example, in their flat or apartment or house, and there's no one else around to help them up, and they are unable to get up, sometimes because they've broken something, usually a hip, and they are therefore on the floor for days, sometimes weeks, unfortunately. And by the time they are found, they are in such a terrible condition because of rhabdomyolysis. Basically, their muscles just break down, releasing myoglobin everywhere, particularly into the urine because of kidney damage. And this is a very severe, life-threatening condition. So anyway, moving on, I just thought it prudent to specify what I mean by hematuria. And this I mean to be any blood or blood products in the urine. This is quite a broad topic, as you can imagine. By the way, when we talk of hematuria, we sometimes also subclassify this into macroscopic and microscopic. Macroscopic is what you see with the naked eye. So basically actual red blood in the urine. And microscopic just means blood in the urine that you cannot actually see with your eyes. You will need a microscope to identify this. Following on from the dietary cause of red urine, I just thought I would elaborate. I mentioned beetroot. Other food or fruits that can cause this include blackberries, rhubarb, and some pigments, food colorings. All of these can turn urine red. So although they're quite harmless, it is quite important to know that these foods or fruits can do this. Otherwise, you go through an alarming and distressful time after seeing your urine turn red for no reason at all. So just to be aware that you can avoid a panic situation, which is obviously not very pleasant. Not to forget, medications can also cause urine to turn red. A good example is a painkiller called phenazopyridine. This is sometimes used to treat the pain caused by urine infections. This medication turns urine orange or red. Certain laxatives containing senna can also do this. Medications, for example, antibiotics like rifampicin, can also cause a red discoloration of the urine. And very often, we as doctors sometimes forget to tell patients that this particular medication can do this, and we end up with panicky and distressed patients because they think something is wrong, when in fact it's just a medication problem. Believe it or not, exercise can sometimes cause blood to appear in the urine. Vigorous physical activity, particularly activities like long distance running, can sometimes cause microscopic amounts of blood to appear in the urine. This condition is usually benign and resolves on its own without treatment. Kidney stones, passing kidney stones can cause microtrauma to the urinary tract, leading to blood in the urine. Depending on the size and location of the stone, this can cause varying degrees of hematuria. Urinary tract infections, again, so any part of the urinary tract going all the way down from the kidneys to the ureters, to the bladder, to the urethra, anything that causes inflammation or irritation or actual infection can lead to blood in the urine. Closely related are the sexually transmitted infections. Sometimes these can also cause bleeding, inflammation in the urinary tract, resulting in hematuria, and not just only in the sexual organ tracts themselves. In both sexes, of course, these two can overlap, or do overlap, I should say, and so you end up with urine which looks red because there is actual blood in the urinary tract, but the blood is actually coming from the reproductive tract, which happens to be at least towards the end of the tract, so to speak, overlaps with the urinary tract. So infections such as gonorrhea, chlamydia can do this. Trauma or injury due to accidents or falls can also cause blood to end up in the urine. There are specific kidney conditions like glomerulonephritis, inflammation of the kidney filtering units, or the hereditary condition polycystic kidney disease, which is a genetic disorder characterized by the growth of cysts in the kidneys. All of these can also cause hematuria. Bladder cancer, or in fact any cancer of the urinary tract, this includes, of course, prostate cancer as well, can lead to hematuria because cancerous growths in the lining of these parts of the urinary tract can actually lead to bleeding within the walls of these tracts. And this can always be passed down into the urethra, which is the tube leading out from the bladder into the outside. As I alluded to above, there are also certain systemic conditions that can also cause either pure blood or blood products, the byproducts of breakdown of blood cells in the urine. And these conditions like sickle cell anemia, autoimmune diseases like lupus, SLE is the other name, systemic lupus erythematosus, and blood clotting disorders can all cause blood to simply appear from nowhere in the urine. Next is another rare but important cause of a red hue to the urine, and this condition is known as porphyria. Porphyria refers to a group of rare disorders that result in a buildup of natural chemicals called porphyrins in the body. Porphyrins are required to make heme, which is a part of hemoglobin, which, as I've alluded to above, is the oxygen carrying part of the blood. It's responsible for carrying oxygen around the blood and is responsible for the red color of blood. Urine from some porphyria patients may be reddish purple in color due to the presence of excess porphyrins and related substances in the urine. And the urine may also darken after exposure to light. A fun fact is that one of the kings of England, George III, was said to have suffered from porphyria, at least as far as I can gather from the 1994 film The Madness of King George. Among the many symptoms of porphyria, which include severe abdominal pains, skin sensitivity and rashes, epileptic seizures and cardiovascular problems, so problems of the heart and blood vessels, including blood pressure, is mental illness, hence the title of the film, The Madness of King George. Finally, there are situations where blood appears in the urine for no apparent reason, all completely normal, all completely benign. It disappears even without excessive exercise. It simply happens occasionally in both men and women, adults that is. And this usually clears up within a week or two. Again, always be vigilant, always have it checked out, always have a doctor look at things if you're not sure yourself where blood is suddenly appearing in your urine, where this is coming from. Is it from a food? Is it from a medication? Is it from a known illness that you already have? Or have you got something new? In all of this, always best to check it out. Sometimes, as with this last type of hematuria that I was just discussing, where it's all completely benign, it will clear up. So sometimes part of the analysis, the investigations that your doctor will conduct would simply be to watch and wait to see if things clear up on their own. Obviously, if a month or two later you're still getting this on a regular basis, then obviously it'll be a good idea to have it completely and fully investigated. So, there we have it, a rundown of the causes of red or reddish urine. Until the next video, stay healthy, and if in doubt about a medical issue, ask a doc.